Awesome. Welcome back, everyone. Thank you all so much for participating in that breakout room. I know it wasn't nearly as long as you probably needed to chat and get to know one another, but hopefully you can pick up the conversation during the breakout room later on in today's session. So I want to welcome you back. Before we kick it off into questions, we wanted to launch a quick poll just to get a sense of who's in the room, where you're coming from, and kind of what hat you're wearing today. So you should see a poll on your screen. Tell us a little bit about the work that you do. Are you a coalition leader or member? Are you a student that's joining us that's looking into getting to public health? Are you some other kind of public health professional, healthcare worker, teacher, educator? And if you're choosing other, please feel free to drop what that other is in the chat box too, so we can get a sense of who is in the room and where you're coming from. It's always helpful information for us to know. Where folks here, first of all, where folks hear about us from, and also where folks are, so what kind of hat you're wearing, so we can think about what might be helpful to talk about in this space as well. So we have about 92% of folks participating. So if you can see the poll, feel free to click on your response. We'll give it a few more seconds for folks to answer. All right, I think we can stop sharing and also share the results so folks can see where we land today. Great. So we've got a good number of coalition folks, a good number of public health professionals, a sprinkling of healthcare workers and teacher educators, and I think one or two others. Director of Early Intervention, co-chair of Behavioral Health, Chana. Wonderful. Thank you so much all for answering that poll and giving us a little bit of a sense of who's in the room today. So we are going to kick it off with some of our questions. And the first question that we want to ask our guest speakers today is to think about what was the number one pivot that you've had in your work in response to the pandemic. So that number one thing that was like, all right, we need to switch and we need to switch it now. So I'd love to pass it on to Shannon to kick us off, and then we'll make our way around our guest speakers. So Shannon, what's the number one pivot that you had to do in your work in response to the pandemic?
Oh gosh, well, probably no surprise to anyone. It would be switching everything online from in-person to online. So sounds very basic, but all of our trainings and support for school nurses typically happened in person. And, that was a challenge for lots of different reasons, all the technical issues, as well as just not meeting in person. School nursing can be kind of an isolating role, and getting together in person was one of the things that brought us joy on a regular basis. That was challenging. School nurses in general were doing a lot of different work in the school. So doing COVID testing, doing contact tracing, those things typically would be done in collaboration with local public health leaders. And certainly that definitely did occur. So our relationships with our local and our coalition members definitely increased in most cases. So that was, one of the, I think we'll talk about silver linings and other things later, but, definitely the switching, I would say, from everything in person to basically online, and then just finding the resources that we needed was sometimes challenging, but I'll pass it along to Rhonda.
Thank you, Shannon. I'm the, started Ocotillo Cultural Center. We are the only Native-run organization in Western and Central Massachusetts, and we serve, multi-tribal Indigenous people across the state. We do focus on Indigenous communities in Massachusetts and those that claim Western Massachusetts as their traditional homelands. But we do, we wanted to make sure that we had a safe space initially for Indigenous people to practice their culture, tell stories, come together. And when the pandemic hit, we realized we had to pivot. And one of the things that we pivoted to was education. And then, of course, early on in the pandemic, I started to follow what was happening with the CDC, and they had issued the COVID-19 mortality rates on Native Americans, stating that we were 4 times as likely to contract the virus and twice as likely to succumb from the disease. So Western Massachusetts has kind of a modest figure of about 5,000 Native American Alaska Native residents. And the county that I live in has about 375. And unfortunately, again, we are that minority that has the highest toll in lives lost per capita. We're still marginalized, we're still oppressed, and we are rendered invisible during the pandemic. Our COVID numbers in Massachusetts were not counted until January 1st of 2021. And, just for example, like in our last election period, CNN counted us in as the native race as other. So we're completely othered in this pandemic. And as Western Massachusetts Commissioner, I wanted to make sure that there was accessibility and equity for our Native American population here in Western Massachusetts. And that question was like the most important thing to me was like, how do we ensure equity of our most vulnerable population in Western Mass, right? So we don't have access to Indian Health Services, which is a federal we have that federal agreement that they're going to be providing health services for us. So we have no functioning Indian Health Services or services that take Indian Health Services. So I also wanted to make sure that we were getting have accessibility for vaccinations. And it was just completely unconscionable to me that Native Americans in Western Massachusetts, we had to drive 3 hours each way to an Indian Health Services in the eastern part of the state to get a single vaccination. And that was not acceptable. So that's when I started my work, was in December and January of 2021, is trying to make sure that we had vaccine equity and accessibility here in Western Massachusetts. All right. That was a lot, sorry.
You're totally good. Thank you for sharing, Rhonda. And I'm going to pass it to Kirby. And we have a list of questions, but I do have a follow-up for you all to think about.
Yeah, so this question really, I had a hard time with it in some ways because in some ways it feels like nothing in my world has pivoted all that much. The symptoms and the outcomes of what has been happening in my world in rural health has changed, but really the root causes and the inequities and the work that we do on a day-to-day basis to try and meet people where they're at and support people where they're at has stayed pretty constant. And so, I think for me, the real pivot was really around how to meet people where they're at when we are in times and in space that wasn't real responsive to a lot of the populations that we serve, and oftentimes being kind of the lone voice in the room, trying to raise up and advocate and understand why we make choices when there's limited resources to hurt certain people. And so, that pivot, I think, in the work was something that was realistic. obviously my physical day-to-day changed in terms of I spent most of my time pre-pandemic like out on the road in rural communities, meeting with lots of different communities and subpopulations within those communities as well. And those relationships, I think, have remained the same, but obviously we interact in a different space in a different way currently. And so that's been a little bit of a pivot, but at the end of the day, the root causes, the work feels very similar. And so in some ways, I think because when you work in populations that have inequities, and when we work in communities that have been disenfranchised, it was a little less of a shift in some ways in the work that we do, in the way that we were kind of meeting people. And I'll talk a little bit more in some of the further questions around how some of that navigates and what that is like. But for me and my work in the State Office of Rural Health and trying to be present and support and be flexible with communities, I think all of that stayed very similar.
So I think you bring up a great point, Kirby, and something that I saw sort of threaded in the responses from Shannon and Rhonda as well, is this like, I feel like the world and sort of everyone kind of dealing with everything took this shift of like, oh, like all of a sudden you started to see folks really thinking about like not only the very immediate, like, okay, what does this mean? Now I have to wear a mask, now I have to get a vaccine, but like this shift of like, how are people doing? Like what, and a hyper focus on those populations of folks that we're working with that are disenfranchised, that are at the sort of very sort of bottom of all the resources that are missing. And then on top of that, we have this pandemic. And so it was like, oh no, like now everything else seems very highlighted. And it brought to the surface, not just the issues that came because of COVID-19, but everything else that we're also all dealing with all the time. So curious, as you all are thinking about these pivots and these things that are coming to the surface, how do you engage with people? Like, how do you connect with people? What does that look like now, almost 2 years in? And then what are some like good and bad that comes with that, either challenges or positives? Like, what does the work look like now that we've got almost 2 years under our belt trying to figure this thing out? So yeah, happy to kind of go in the same order as well, and leave it to, or have Shannon start us off, and then Rhonda and Kirby.
Yeah, thank you. I think, again, as no surprise to everyone else, we've all become very familiar with all of the online platforms, Google Meets and Zoom, and they all have their different idiosyncrasies. Obviously, one really amazing positive is that I could get in a room with all of my statewide colleagues in about 2 minutes if I needed to. If we were having a crisis we were trying to solve, or something came up and we really missed that face-to-face, it would be harder to get on, like, let's say a phone call in the past, but now it's like nothing to us to just set up a Zoom. We'll text each other, let's Zoom, let's talk about it, let's work it out. So it's been really good to be able to actually see each other's faces and be in a room where, we service across the entire state, just like my colleagues on the panel here, service a large area of the state, if not all the state. And so that's definitely been a positive, and something that I hope will certainly continue. I definitely miss face-to-face though. I miss hugs in a big way. I'm a hugger. So if I know you and I've met you at least 3 times, I'm probably going to want to give you a hug when I see you in person. So I definitely hope we, I know we will get back to that someday. Just really looking forward to that personal touch. As a nurse, you can imagine, like, that's something that we find very sacred, is that personal touch with people. Although I don't do patient care now in my role, it's definitely something that carries through, with all of the work that we do. And Gosh, what else has changed? I think I'll leave it there for my colleagues. I know we have other questions, so I'm sure we'll have opportunities to talk about the other bright spots, but I will pass it along again to Rhonda.
Oh, thank you so much. Gosh, so different ways that we've been connecting with our community. One of the most important ways, and we've really, it was very successful, was we have a community engagement where is called place-based learning, or land-based learning. So we have people come and arrive at Okateo. We have a great amount of land that we have accessibility to, and we can be outside and it's safe, and we can talk about our traditional values and how they pertain to, staying safe, not only during the COVID, but how to, abstain from drug and alcohol use, how to have healthy relationships. All of this is very important, considering that we are now even more isolated than ever before. So that place-based learning, I think, was one of the best ways that we connected to our communities. Oh, you're losing me there. And also we did a lot of online, checking in with elders, checking in with families that have small children, making sure that they're okay, they're healthy, they need anything, trying to make sure that we can connect in some way, that they're not alone. We did have at least one member who was sending out boxes of traditional medicines, which is also an important factor during a pandemic like this, is making sure that there is accessibility to our traditional methods of healing. So we have created a little bit more, obviously, online presence, using social media and texting. That's been enormous. And of course, Zoom. I honestly think that that's been a huge eye-opener as far as accessibility. I hope that we don't go back. Like, this is something that, especially in our educational programming at Okateo, we do a hybrid version, in person and online, and that is enormously successful. And we actually have people who watch us all around the world when we do a program, and that's something that we never would have considered, previously, and we're not going back. People who normally don't leave their house because they have immune issues, they're finally seen, and we're going to continue to do what we're doing. So thank you. Kirby.
Yeah, I think I would just echo what both of my colleagues have said in terms of kind of the shift in virtual space. For us, because we did operate in the rural space, in the rural world, we did use some virtual platforms and meetings pre-pandemic a little bit, but obviously there's been more availability and uptake in the last 2 years from folks. The ability to have hotspots and things put out in some of our more rural areas allowed parts of our population to connect in ways that they've never been able to before, and that was really empowering to see and to be. And obviously, for me personally, like, I'm able to be in more spaces because I'm not in the car for 4 hours driving in between meetings. And that's a positive, but I think the challenge that comes with that is also being effective in space. So like, when we're engaging with community, it's more than just like being present in a space. Like, it takes a lot of energy and active listening and holding a lot of things when you're in space with others. And this back-to-back Zoom world can really drain that out of you in ways that I don't think I understood pre-pandemic. And so I think a balance in that is also building in space for some of the recovery after working with communities and engaging with our communities in these virtual spaces, having some of that buffer time. I didn't realize like how much the car helped me kind of like decompress and get my thoughts together and reconnect and think about the experience that I just had. And, at the end of the day, we're still meeting in physical space in some places with folks where it's safe and when we're able to do that. Because there is that value in relationships and something that we can't always get. And I know personally for me, like people's energy and the space and where I'm at, is huge. And a lot of the like important pieces of my day-to-day kind of work out in community were some of the like in-between conversations. I think you brought this up at the beginning, Gina, like, I might be a place for a certain thing, but then I get to like run into Rhonda for a second and have space to talk about like what's happening, in that world, or, in people's lives, or connecting to just say, hey, how's your kids? And like, oh, I saw you had a baseball game last week, or, those sorts of things that, although they're not necessarily quote unquote the work, they are part of the work in a way that I think those of us that work in community understand in a different way. And, it's been having to be creative about that. Like, so setting intentional time to reach out to people that I normally would just kind of collide with out in the world, to like reach out and say, hey, can we like just connect for 15 minutes? Not because I want or need anything from you, just because like I value you as a person and I want to spend space with you, to connect. And so, I think that's been kind of the positive, is like, yes, Kirby Lisi can be everywhere. But am I actually there? And so having to build some of those boundaries in space so that like I can be fully present.
Awesome. Thank you all for answering that question. I think as somebody that also spent lots of time on the road pre-pandemic, going from training to training and sort of spreading the love of CHTI, one of the things that I think we as a team sort of noticed is, that like when you're back to back online, how much of a toll it can have on you. And then trying to figure out what the balance is, because when you're online and you're not requiring people to travel or to be in space with others when they're immune compromised, you're opening up a whole world of accessibility that perhaps we didn't even think about before, right? Because we weren't forced to, as we were with this pandemic. So trying to figure out what that balance is to make sure that we're taking care of ourselves and our communities, and also making sure that we're accessible to our communities as well in a way that works as we figure this whole world out. So keeping all of that in mind, I'm curious, aside from like doing work online, are there any other sort of challenges that have come up in your work that have been consistent over this course of the pandemic that you all want to highlight and share a little bit about today? And then Shannon, I'll pass it off to you. Kick us off.
Yeah, thanks for this question. I think a consistent challenge that was kind of there before the pandemic, but even more importantly now, is communicating with families, and particularly, families that are hard to reach anyway because of whatever barrier, language barrier, culture, anything. It's, I'm constantly the one in the room saying, okay, that's a great flyer in English, but can we also have it in the at least 5, which is like, a very small number, but at least the 5 top languages that our families speak. And just continually presenting that message and making sure that our partners that, maybe hadn't thought about it before, but have thought about it in a different way, is how are we reaching the families that need it the most, right? These are probably families that Rhonda and Kirby are very familiar with, because they are, again, pre-pandemic, there were struggles to communicate with them and to make sure that they had the resources they need, whether it was, the language or the culture, or just any way to communicate with them about what's available to them, why it's important to them. Everything from, how to communicate the message to what is the message. A message is not just translated from English to another language and the meaning is still the same for everybody, right? And how do you kind of overcome those kind of things, which are very challenging when everybody is so busy. They're basically, head down, doing their work, so busy. You need to stop and take a breath and say, okay, are we meeting the needs? Are we getting to the people that we need to get to? That still continues to be a huge barrier, but I think there are resources now, more resources, more awareness about the issue, and that, you know, we are collecting now some statistics and some data about who's immunized, who's, you know, getting sick, who's dying. Like all of those things are really bringing to light the disparities that were always there, but now more people are able to notice. So unfortunately it's happening, but fortunately I'm hoping that people are noticing, okay, now that we know about something, you can't not do something about it, right? Before, it's like, before they knew, they probably knew, and I don't know who they is, but I'm just generalizing here. Like before we knew what the problem was, and some of us do, and others maybe not so much, but you can't not do something about it now. Kind of like racism as well, right? Like once you know, you can't not know, and you can't not do something about it. And then the other one was just, I mentioned the workload has just been so high, and I'll talk specifically about school nurses. Their workload has increased at least twofold, sometimes 2.5 or threefold, unfortunately. And they're so busy that it's hard for them to get back to the work that they were doing, the really good case management for some of the families that really needed that higher touch. You know, I'll date myself now. I learned to be a nurse 25 years ago, right? And 25 years ago, we were told, nurse, you treat everyone the same. Everybody gets the same. Well, we know now that that's not true, right? Everybody gets what they should get, what they need. And so I need to pay special attention to specific populations, which I'm learning from data now, and how can I meet that need, right? And how can I give that population what they need in order to be equitable? So not equal, right? The care that we give should not be equal. The care that we give should be equitable. And it's been really, really hard to do that because of the workload has been so high. And I'll pass it along to Rhonda.
Thank you. Oh my goodness, this is a loaded question. Thanks, Gina. I feel like, gosh, I could go lots of different places with this one. I feel like in the work that we're doing as far as the COVID work as a tribal and indigenous person serving organization, we are having trouble with help. So, you know, we've had people that were working with us and, you know, different personal reasons, you know, there's been deaths, there's been other things they can't assist. And so then we're stuck, and it's really challenging to do this work when you don't have the help that you need. And I think that just goes, it's everywhere. It's not just here. It goes across the board. And also we've been having a hard time, you know, finding people that are willing to share their story so that we can do our part to get vaccinated, because it is such a contentious issue. Native Americans, we're still behind. We're the last race in Massachusetts to be vaccinated. I'll be honest, I think that I haven't checked in the last couple of weeks, but I think that we're hovering around 50%, and that's not okay. And we have a lot of work to do. We're struggling against the white coat syndrome. We're struggling against, you know, trust within the government and the health agent, you know, the health industry. So finding people to share their story is not the easiest thing. And then when they do want to share their story, you know, we have to, do we meet them in person? Do we have, you know, can we send somebody to photograph them? We have to like figure out all the logistics, and that can be a struggle. So we're a little behind on things and where we want to be. But I'm feeling like that's our biggest struggle right now is finding good help to get our message out, to do our part, you know, especially in the vaccination campaign. Yeah, you know, I guess I'll save the rest for other questions, but I think that that's been the hardest part, is engaging and connecting in our community, and the help to do so. So thank you. Passing it on to Kirby.
Yeah, so I echo a lot of that, Rhonda, and I think the big thing for me and the challenge is both, I think, personal and also like my work, is that the elephant in the room is like, I work in a system that does harm. And so I work in a system that does harm, and I'm also a person with lived experience in the community that I serve. And so reconciling those things can be incredibly challenging, and incredibly challenging in a way that, like, I have really special relationships with many of the communities that I work with and work in, and they're people that I care deeply about. And so when decisions are made that impacts those communities as a whole, like, can be a really tough thing to navigate. And being transparent with communities that these sorts of decisions bring up a lot of historical trauma and mistrust. And then also being a person internally that's called on by peers to say, well, what's going on? Like, why isn't this working? Why isn't this happening? And, how to reflect that back, and how to do, like, authentic work when there's decisions being made that you don't agree with in a lot of ways. So I think those have been a lot of the challenges and the barriers that I've seen. And, like, it stings that many of my communities that I support and am present in, have very low vaccination rates right now, hovering in the 50s, and have high COVID rates that's impacting them. And also, like, navigating and being respectful of people's personal choice and decision that comes from things that we did. Like, the systems that I'm a part of created this. And so, that's a lot to balance, I think, in this. And we're human at the end of the day, and we're human in the communities that we work in, the people we serve, whatever your connection is. There's been a lot to balance, and, like, balancing that I hold some power in the room, it feels uncomfortable sometimes. And how do you use that in a way that's going to best serve the populations that you work with? And I could go a lot further, but I'm going to stop Debbie Downing. Like, that's going to be my last, like, sad thing to say today, because I feel like I'm just like, for the last couple of questions. So I'll pass it back to you, Gina.
Oh, you're not Debbie Downing at all, Kirby. I think one of the reasons, and I believe we had this conversation when I was talking to all three of you, is that one of the reasons we think it's important to ask questions like this is because you all are not the only ones dealing with this, right? We're all trying to figure this out. And I think that's where we learned best, when we're able to connect with one another around, like, oh, you're also dealing with this thing. Like, how have you been trying to address it? This is what's worked or not worked with our community. Perhaps we can, like, swap strategies or talk further and see if we can learn from one another. Like, that's part of, I think, the secret sauce that, like, sometimes is missing from when we're not able to connect in person. So as much as we can try to create that space online is really our goal here. And they're not the easiest conversations. They're not the funnest, but they're real, right? It's happening in real time because we are human. We are working within all different types of communities. So hopefully this next question will kind of bring us up a little bit, because I think we are all sort of struggling and dealing with the challenges that come with doing this work in the middle of a pandemic. But I think what also comes from that is, one of the things that I've learned throughout the last almost 2 years is that our communities have amazing resiliency, and the work sort of births creativity and innovation. So I think one of our last questions, or one of our sort of prepared last questions that I want to ask you all, is, like, what's a victory that you've had? What's a win? What's, like, a good thing or something that has come up for you that you're like, yes, this is what, we work for. This is what's kind of carried us through. So Shannon, I'll let you kind of start off this round.
Thanks. Yeah, it's important to bring up the challenges, and we also want to talk about the solutions, right? And how to do better. I think not being on the road, similar to Kirby, I was on the road a good majority of my days, probably at least 3, sometimes 4 days out of the week. I was in my car traveling to a meeting or visiting a school. And when that isn't happening, we definitely have more time to sit at our computers, do some work, meet with people on Zoom. So one of the success stories that I've personally had is actually I put a coalition hat on now. I belong to Children's Vision Massachusetts, which is a coalition of 80 members, healthcare professionals, and all the way to lay people and others that care about children's vision and improving children's vision. And I was able to work with some state and actually some nationwide leaders in children's vision, look at the research and the data and come up with some protocols that are evidence-based. We were able to update those protocols over about a 12-month period and actually have them approved by the Department of Public Health because it is evidence-based, and we all want to do good work, and good work for nurses is based on evidence to support, what is good. And so that was a really, I wouldn't say a small success. I would say a huge success for children and children's vision. When kids can't see, they can't learn. And so what may seem like a very basic thing, there's ways that are helpful, and then there are ways that are not helpful. And we were able to look over what works and present that to Department of Public Health, and fortunately have some new protocols now. The downside, of course, is that many people thought, why now in the middle of a pandemic are we updating our vision protocols across the state? Well, it doesn't actually go into effect until September. But this was really years of work. And so the background was it wasn't happening like, we decided during a pandemic, it was a great idea to change protocols that school nurses used. We've been doing this work for years, literally years, to try and make sure that the work that we do is supported, and that kids, at the end of the day, it's really all about the children and children being able to see so that they can learn. And that was a huge success. I thought there was one more thing I was going to say about that, but I think just the advocacy piece, being able to, again, some of the coalitions that I belong to are statewide coalitions. I belong to a public health coalition as well as some substance use coalitions, and having a way to connect more frequently when needed to, and or just being able to connect, on a whim was really, really positive. And again, hopefully that will carry through. And I'll pass it along to Rhonda.
Thank you, Shannon. Gosh, so there's been quite a few wins. A lot of it's in representation. So we have 3 of these flyers. I would share my screen, but we have flyers that they're like posters, and they're up in several different doctor's offices locally. And that's amazing to be able to walk into a doctor's office and see yourself represented. Like that's huge. Like I only see that in Indian Health Services, like to me, that's massive. We've also, we're able to share one of these books, Our Smallest Warriors, Our Strongest Medicine, and it's honoring our teachings during COVID-19. It's a children's book. And that we've been able to get 200 copies of this book and be able to share that in a lot of the teachings that we do, the place-based learning. Anyone that comes to any of our events, we have them out. We've been at several different events like Indigenous Peoples Day events. We had two days where we set up tables and just gave out these books. We also have a lot of the different books, stories and poems for tribal families. And this is in conjunction with, the Mass Department of Public Health. So we have another series. I don't have it with me, but we have a lot of information now by and for Native people. And that is so huge. Oh, it's my lap, the Coming Home book. Preventing alcohol and drug use among Native teens. But this is very important because the stories inside also tell us, who we are to be, our Indigenous, building strength. our own teachings, our own way of being, like, tell us how to be during this pandemic. And that is to look out for our children, look out for our elders, look out for our communities. And to see and be seen in this way is huge, is absolutely enormous. Also there's potentially going to be a clinic that will accept Indian health services here in Western Massachusetts. And that is also enormous. That I feel like is one of the biggest wins. I've been working on this issue for almost 20 years. I know that Mass Health has it in their paperwork, their printed paperwork that you receive says Native Americans living in the state don't have to pay for premiums and will receive Mass Health. But when you go to do it, it's not in their programming. Their computers aren't programmed to do this. So it requires hours and hours of talking to people and talking to supervisors. And it's ridiculous. Who's going to do this? Like, nobody. Me. I'm the only one that's done this. So if we can actually, like, create a system where Native people, you know, and we're living in the 5 College area, where they can actually receive healthcare without having to, you know, go through these hoops through Mass Health, that's going to be an essential win for our communities. Yeah, so being seen, being heard, those are really big wins as far as I'm concerned. Kirby.
Yeah. So despite maybe my prior responses, I am really a like silver linings kind of person. And, you know, I try and find, I think when you work in systems like state government, we're always looking for like the path of least resistance and windows of opportunity to like move things forward. And we've had huge windows, which have just, it's been really incredible to be able to sit at a number of tables and talk about things that I've been working on for my entire career, for the last 20 years in rural communities. We've been able to really bring a lot of those challenges and advocate at the forefront around them. And so that has been, that's been big. And, you know, I think in the same echoing what you've just said, Rhonda, a lot of our communities feel very seen for the first time. We were actually able for the first time ever to get data through these rural clusters that we use to kind of disaggregate data so that there's somewhat localized data. Because like, guess what? Rural communities are not homogenous. Like, they're very different across the state. And so when we just do rural and urban, that very much waters down, you know, what's happening in our areas. And so, you know, we were able to really push in places to get some movement in space. And I think most excitingly, for the first time ever, we've got funds that are going to be going directly out to community-based organizations for them to empower their own work. And not to do anything new or innovative. I'm sick of that. Like, there's nothing innovative. It's work that's been happening in communities that we haven't been supporting and funding for decades. And it's time for us to recognize these community players and coalitions and groups financially so that they are able to continue to do the good work with the people and their community. And so that has been really exciting for me, that we were able to squirrel about $4 million over a number of years for rural communities. And I can tell you that that is the very first time there has ever been some sort of a direct investment. Like and like, let's be honest too, it's also not a direct investment. It's dollars that are coming from the CDC that we were able to advocate for. You know, and I think we need to do more work in advocating in many spaces for a lot of our disenfranchised populations to be carved out within our own state funds that we pay taxes into, so that our communities are being supported and heard in the same way that white urban communities are. And so, you know, I think it's important for us to continue pushing this. So I'm celebrating the wins of what we've gotten, but also thinking about like how we position for the future as well. To make sure that our communities are continually heard and seen and supported, you know, and that we have access of all kinds of things. You know, we've seen, because of some of the digital space that we're in, our communities be able to access things like mental health services for the first time. You know, one of our rural health centers said, gosh, we were able to clear our mental health wait lists for the first time ever. And we've been able to expand services. And so those kinds of things are big, and they're big wins. But it just makes me hungry for what else and what more we can do.
We want more and all the wins we can get. And those are some big wins. I loved hearing sort of the brightness that came from you all as you shared part of your work. And yeah, wonderful. Rhonda, I see you waving. Go for it.
Yes, yes. I totally thank you, Kirby, because Health Resources in Action, right? So we've been doing this. I was doing this work, and now we're actually like getting recognized, and we got funding to do this work. And I am eternally grateful for this. Like, I don't know how I can do this on my own, like volunteering, and it was ridiculous. And to be able to get funding and recognition through Health Resources in Action as a tribal person and Indigenous serving organization, that's huge. So thank you for bringing that up. I appreciate that so much. That's a huge win.
Yay for those big wins. Thank you for sharing that, Rhonda. All right, so this is what we're going to do. We had some questions. Thank you, the three of you, for answering them and sharing more of your perspective. So we're going to give you all a chance to, one, ask questions, share resources, and do all that wonderful things. But we're going to do it slightly different. So we're going to break into some breakout rooms, and we're actually going to have Kirby in a breakout room, Rhonda in a breakout room, Shannon in a breakout room, and then you'll be joined by CHTI team members as well, just so you know. And then we're going to invite the audience to kind of pick which room you want to go to. Who do you want to chat with? Who do you have questions for? And we're going to spend about 10 to 15 minutes in those rooms, just kind of chatting, having some conversation, and you're welcome to move in and out of rooms as well. So I'm going to invite Jasper, our tech lead, to open up the rooms, do what you need to do, all the magic behind the scenes, and invite you all to join which room you'd like to go to. All right, I'm gonna head to my room as well, team. So I will see you if anything. Jasper, ping me if anything as well. Corey, you got cut off. No worries.
It's okay, I was done.
Appreciate the small group conversation I had. I hope you all had wonderful small group conversations as well. And I know we shared probably in your small group the link to the word cloud. So if you didn't get a chance to fill that out, we can drop that in the chat box as well one last time. And also one of the things, or so one of our aims for conversations like this, and actually all of our trainings, is to really get a sense of like, do you find spaces like this useful? And are these conversations sort of helpful in thinking about your own work? And part of the way that we gauge like whether things like this are successful or not, and some of you that have been to our trainings probably know where this is going, is that we ask you all to fill out a feedback form. Like, how do you think we did? Is this useful use of your time? And what did you think about this new format that is slightly different from our traditional trainings? So thank you, Jasper, for adding that feedback form into the chat box. We'll give you all a few minutes to fill that out as well. It's just a SurveyMonkey link. You should be able to just click right in. And it's hopefully just takes a few minutes to fill out the questions. So I'll give you some time to do that. And then we'll hopefully share the word cloud and wrap up in these next few minutes. But just want to echo a huge thank you to our guest speakers. Thank you so much for chatting with us today, sharing your stories, your perspective, the good, the bad, and all the in between around your work. And in our follow-up to this conversation, we'll share the contact list. If you gave us the okay to share your contact information, I'll do so along with, we'll share the feedback form again, and encourage you all to continue to engage with us. Follow us on Twitter, come to our website, all of the wonderful things that we've got going on. And if you're not already, sign up for our newsletter as well. And encourage you all to follow up with our guest speakers. They're doing amazing work, and I'm sure we'd love to continue to connect with folks that are doing similar work across the state as well. Wonderful. So I'll open it up to either the guest speakers or the team. Is there anything else that you want to share in this space before we close and wrap up?
I just want to say thank you so much. I really appreciate this coffee chat. I think it's pretty amazing. I wish I jumped on them before. So yeah, thank you so much. I really appreciate this.
I would
Wonderful. Oh, go ahead, Shannon.
Sorry, I would love to say thank you so much to Rhonda and Kirby. This is the first time I'm meeting both of you, and your work is amazing. I'm so happy that you are able to get some funding and carry on the work and keep doing great work, because it's so important and so appreciated. And I learned a lot from you both today, so thank you very much.
Right back at you, and it's just been wonderful to connect in this space with folks and have real conversation about the day-to-day and what's happening.
Awesome. Thank you all again for joining us. Let me see if the Zoom world of sharing my screen will allow me to share what we've got going on here in our word cloud. So thank you all again for jumping in there. For some reason, I have to figure out how to download this picture. So you're just seeing my screen right now, but we'll follow up in the email of all the wonderful things that came up: innovative, chaotic, creative, challenging, hectic, flexible, ever-changing, evolving, strengths, all of these wonderful words, and just like this and so much more. I know that a couple people had to drop off at 11 for other meetings, but I'm sure they would have added similar and more words as well. So we'll include it in the follow-up email so we can hear from the folks that didn't get a chance to stay till the end. Just want to echo a huge thank you to you all again for joining us today. And then stay on the lookout. We have a training coming up in February. And if I don't see you before then, I hope you all have a wonderful and relaxing holiday season, and that you all get a chance to get some time off and reconnect and do all the wonderful things that you do during your holiday. So thank you all so much. I hope you have a great rest of your day.
Thank you.
Thank you.